Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to today's news conference for the latest in COVID-19 information for the Amarillo community. We do these every Wednesday at 11 a.m. Let me go ahead and introduce who is on our panel today. We are joined by Amarillo Mayor Ginger Nelson, Casie Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weis, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Emmentier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We will turn over to our panel here for brief opening statements, and then we'll take questions from our media who are in attendance. We'll start today with the Mayor Ginger Nelson. Mayor, how are you this morning?
I'm well, Dave, thank you. And good morning, Amarillo. I want to thank all of you for what you're doing during this pandemic. The changes that you're making to wearing your mask, washing your hands, staying home if you have symptoms are making a difference in our city. As we've gone back to school, we have seen our cases rise, and that is to be expected. Something that Casie Stoughton with the health department is going to talk about this morning is the outbreak of positive cases that we've had at the Neal unit, which is the prison north of town, but it is in Potter County. None of those patients are hospitalized at this time, unless Casie has an update that I don't know about. But that's something that I think each of us are interested in, aware of, and will be praying about. So really at this time, Dave, that's all I have, but I look forward to hearing what our panel has to say today.
Thank you, Mayor. At this time, I'll go to Casie Stoughton, Public Health Director for City of Amarillo. Casie, how are you?
I'm good. Glad to be here this morning, Dave. As of yesterday, there were a total of 8,920 cases of COVID-19 reported in Potter and Randall counties. 5,938 in Potter County, 2,982 cases in Randall County. We have a total of 6,595 recoveries, and we are up to 112 deaths in our community. Our heart goes out to each of the families who have suffered loss throughout this pandemic. That leaves us with 2,213 active cases of COVID-19 community. Each of the cases do represent a unique individual, and the report card at 2:30 will reflect additional cases that have been reported to public health over the last 24 hours. The rolling 7-day positivity rate for Potter Randall County is down to 10%. The positivity rate at the drive-through testing site is up to 23.23%. The Panhandle RAC's 25 county region hospitalization percentage is at 11.90%. Yesterday's report card did reflect a dramatic increase in positive cases. Mayor Nelson commented on those cases from the Neal unit. We had 1,011 cases reported to our department from the Neal unit, TDCJ's Neal unit. They have put out a statement that very few, in fact, only 6 reported individuals, inmates are symptomatic, and the hospitals will be able to comment on any cases that are any people who are hospitalized. Prevention efforts such as masking, flu shots, hand washing, social distancing, and staying home if you're sick are critical as we continue to see positive cases. As the team at Public Health conduct contact investigations, we have not identified any hotspots other than this one at the Neal unit, but no local hotspots. We have generalized transmission here in our community, and so it's very, very important that we isolate. If you test positive, that you isolate away from others in your house for a minimum of 10 days. And if you've been exposed to someone who's positive, that you quarantine for 14 days from the time that you have last been exposed to that positive. So what we call the break-in contact, from the last time that you were around that person who was positive. Those pieces are very, very important to slow the spread of COVID-19 here in our community. The public health drive-through does remain operational. You can call 378-6300 and our call takers will screen and direct you to the test site. As we move into October, which is the 7th month of the COVID response, I want to thank the staff at Public Health, Environmental Health, all of the healthcare workers, and our community as we continue to fight against COVID-19. It has certainly been a long 7 months, and I was reading an article about compassion fatigue, response fatigue. These are all very real elements, and so I just want to thank and encourage all of the responders as we move into October. Certainly want to thank and encourage you. You've been such tremendous responders, and so keep up the good fight, keep up the good work as we work together to keep our community safe.
Thank you, Casie. At this time, we'll now go to Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center. Dr. Milton, how are you?
I'm good. Good morning. And good morning, Amarillo. A little comment about the Neal unit. You know, we've talked about this many times before about vulnerable populations and populations that are confined. And as we've seen throughout this pandemic, it's individuals who are in enclosed spaces and in large numbers that seem to have an increased risk of contracting the COVID virus. So once again, this is what's happened, and it's just a reflection of how contagious this virus is. And the importance of trying to practice social distancing and to try to wear a mask always. And because you're going to protect your neighbor that way. You protect your neighbor more than yourself by wearing a mask. Now, I was over at Northwest this morning, and Dr. Weis may be able to comment a little bit more, but I always try to round through the portion of the hospital that we call the locked unit, where the inmates are hospitalized. And from this morning, from talking to the officers there were 3 individuals from the Neal unit that were hospitalized there. There was a total of 5 inmates, and only 3 of them were from the Neal unit. So, how could this affect our community? Well, I think that the main concern that I have is the effect on the hospitals and the resources in the hospitals. And I think that generally speaking, as you can imagine, I mean, these individuals who are infected at the unit are confined and being monitored there. We have a pretty good relationship at Northwest with the officers, with the correctional officers, and kind of keep our ear to the ground at the hospital about what's going on at these different units. So I think we'll be able to manage this. It's just that it's certainly concerning, and it's a dramatic outbreak. And that's all I have, Dave. Thank you.
Thank you, Dr. Milton. Now I go to Dr. Brian Weis, Chief Medical Officer for Northwest Texas Hospital. Dr. Weis, good morning.
Good morning, Dave. How are you?
I'm good.
So, look, as has been reported, Northwest did incur a disruption of digital communications from corporate UHS this weekend. And basically, it's forced us to resort to using this flat white entity called paper. And it actually took me about 30 minutes of the day just to find a working ink pen in my desks. But anyway, our IT department is doing a phenomenal job of working around the clock to get us back up to speed. Our nursing staff, our ancillary staff really have not missed a step when they converted to our well-rehearsed downtime procedures. The biggest thing is we do not have any evidence there's been a breach of either patient or employee information. But we'd also like to thank our local healthcare partners, BSA, Texas Tech, the VA, for their understanding and support during this challenge. But seriously, seeing the way the hospital works now is bringing back fond memories when I was a young doctor. I mean, so much so that I'm going home at night and reading my emails by candlelight. Anyway, our biggest challenge in the hospital is reading the physician's writing. Who would have guessed? So, but anyway, we will be back up to speed in no time. But on to COVID. So right now we have 27 positive patients in the hospital. That's where we've been tracking for about the last 1 to 2 weeks. We have 13 in the intensive care unit, and 6 of those are on ventilators. Right now we're using 18 of our 40 total ventilators. We did have 11 patients ultimately succumb to COVID during September, which was not a good month for us. Right now, we do have one child in our pediatric ICU with COVID. In terms of testing, we have a bunch of both PCR testing and antigen testing supplies. Now, interesting, we've been using some of these respiratory panels now that include COVID-19. And I myself tested a couple of people last week who had concerning symptoms, and it turned out they had the common cold. So we are now seeing that mixed in with these symptoms, and these respiratory panels are helping us define what's COVID and what might be other common viruses that we see in the fall and winter. With remdesivir, we've got enough remdesivir to treat about 42 more patients. Right now, we have 8 patients on the drug. We've treated a total of about 130 patients with the medication. Flu shots, we had a 72-hour blitz last week on our employees. We inoculated over 1,500 employees in 72 hours. So we're set to go. And I encourage everyone to get a flu shot this year to protect you and your family. And finally, in terms of the personal protective equipment, we're doing very well. We've been able to hoard quite a bit over these last few months. And we feel very confident going into the next couple of months that we will be able to supply appropriate PPE for our staff and our visitors. That's all I have for this morning. Thank you.
Thank you, Dr. Weis. We'll now go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you?
I'm doing well. Good morning. From our standpoint, as far as starting off with COVID numbers, we absolutely are in another surge compared to where we were earlier in the year. Since about the 18th of September, we have had 40 or more hospitalized cases of COVID at BSA. Today, we're at 48 cases hospitalized. What we're seeing is that it looks like we're having fewer of those patients in the intensive care unit out of the total, which I would say is a little bit of a silver lining. 14 of those 48 are in the ICU, and out of those 14, 6 are on the ventilator today. 29 of the patients that we have admitted are in our med-surg unit. We do have one pediatric patient currently admitted and a couple patients on our L&D unit. Those that are not in the ICU are obviously less severely ill, but still having issues that warrant hospitalization. From a resources standpoint, we're currently using 17 of our total 40 ventilators. Again, only 6 of those ventilators right now are being used for COVID patients. The others are for non-COVID patients. Our intensive care and intermediate care units remain with a high census, and our nurses are working hard in terms of managing all of our ICU patients currently at BSA. I was rounding through our surgical intensive care unit this morning, and our nursing staff has a very positive attitude. They're working hard, they're carrying multiple patients, and we need to continue to support them as much as possible during this difficult time. You know, from a COVID perspective, since the beginning of the pandemic, we've now had over 625 unique COVID admissions. And that is a significant number of patients. That is a significant experience that we have had at BSA in terms of managing COVID patients. And when you look at our Ardent system, which we are part of, we have an even more broad experience, obviously, in terms of the number of patients we've managed. Some of the things that we've seen that have been beneficial to date have been our remdesivir utilization, and we have seen what looks like a reduction in length of stay with that drug, which is not too surprising because that's also what some of the good trials have shown in facilities that have been using remdesivir. We also are seeing what appears to be a mortality benefit in those receiving dexamethasone, which is also not a surprise because there's also some data that suggests that we may have and should be getting hopefully more of a benefit with that drug when utilized in the proper patients that have COVID positivity. And I think that's really where the bulk of data at this time lies. We are continuing to enroll patients in our Regeneron trial. We've had 23 patients to date enrolled, and there's been some early press that an early investigation of the patients nationally in this trial are having what appears to be some positive benefits, although I would say with the caveat that it's probably still too early to know for sure if this treatment is going to be one that pans out to be significantly effective. From a vaccination standpoint, we are rolling through our mandatory vaccination protocols for our employees, and we're doing a very good job of getting the bulk of them, including myself and others, vaccinated. We still have some to go, and our employee health teams are working well to do that. I encourage everybody in the community to get your flu shot. As our other health experts have said today, it's critical, especially as we move forward over the next couple of months. And it's not too early to go now for your flu shot. Hopefully we'll have a vaccine for COVID coming out over the next couple of months. We're all anxious about the data that's going to come forth with those vaccination trials. And I think that we are going to be just as scrutinizing about that data as we have been about treatments that have been put forth for COVID-19 up to this point. And it's by that healthy scrutiny, I would say, that as what makes us a strong medical community and a strong nation when it comes to utilizing medical therapies, because we don't jump on the first thing that comes forward and suggest that it's going to be the savior. We wait for the trials, we criticize and critique the trials, and then move forward when we think we have an effective and safe treatment. And that's what I think makes our medical community across this nation a great one. So again, we are holding strong here. We have high volumes. For anyone who is thinking that we are through with COVID in the community, that is not the case. As our experts have told us today, the hospital here, I think, is doing well, and we're appreciative of Northwest also working hard to manage these patients. And we've been communicating during their difficult time with this cyber crisis, and we are here to help as needed. So thank you for the time today.
Thank you, Dr. Lementier. We'll now go with Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, good morning.
Good morning. First of all, thank you for this opportunity again. First, to go into our numbers, for COVID positive patients, we have 3 COVID positive patients, 1 in the ICU, and the other 2 are on our med-surg floor. We do have 30 veterans who are at home on self-isolation that we are monitoring who are COVID positive. We do not have any veterans for which we are waiting their results currently. As mentioned, we have been going through our flu vaccinations for our employees. I was not here last year, but I am told we are doing much better in getting our employees vaccinated than last year. And we've also have our flu fair going on here on the Amarillo campus. It'll be going through Saturday from 8:30 to noon each day up through Saturday. And happy to report we have about a 50% higher response than we did last year in veterans showing up to get vaccinated. So encourage those veterans to continue to come here and get your vaccine. If you cannot make it during those times or are unable to make it this week, you can still see your primary care provider here who will make sure we get you vaccinated. Last thing I wanted to mention is today's the final day of September, which is Suicide Prevention Month. And while this might be the last day of the month where we focus on suicide prevention, we know suicide prevention is something that not only here at the VA, but throughout our community is exercised day in and day out by many, many workers looking to assist those people in need. And so I do want to thank our staff and our community partners who work tirelessly to help those individuals who may be contemplating or considering harming themselves. And so with that, thank you again for this opportunity to talk to my fellow veterans, and have a great day.
Thank you, Dr. Gonzalez. We'll now go to City Manager Jared Miller. Mr. Miller, how are you today?
Doing good. Thanks, Dave. Just want to remind everyone the drive-through testing center remains open. If you feel sick and you have symptoms you think might be COVID, call the public health hotline at 378-6300. You'll be screened for the drive-through testing center. If you're positive, if you do call the public health hotline and you are referred to the drive-through testing center, the city is also providing free transportation through our public transportation through Amarillo City Transit out there. So if you call 378-6300 and you're referred to the mobile testing center, to the drive-through testing center, call Amarillo City Transit at 378-3095 to arrange free transportation. We want to make sure that there's no barriers to getting these tests. Also, with regard to the governor's order GA 30, that's the executive order that is the primary impact on the city of Amarillo right now. This order superseded GA 28, which we had been under for 2.5 months. The following businesses can operate at 75% occupancy, except when if we ever get classified as an area of high hospitalization. So retail stores, restaurants, office buildings, manufacturers, museums and libraries, gyms and exercise facilities can right now operate at 75% of their authorized capacity. If we do go into an area of high hospitalization, and that would be our hospitalization rate as per the governor's definition, is over 15% for 7 consecutive days, then all of those businesses I just mentioned would go back down to 50%, which is where all of the rest of our businesses are, with the exception of bars, which are not allowed to be open right now. Now, there are also essential businesses, and all of those are allowed to be open at 100%. That's all I have, Dave.
Thank you, Jared. We'll now go to questions from our media members. If you have a question for an individual panel member or the panel as a whole, that's completely fine. Let's go ahead and start with David Gay of Amarillo Globe News. David, how are you today?
I'm good. Good morning, everybody. I guess my first question is with the NEAL unit numbers, and I'm not sure if this is a question for Casie or if a question for TDCJ. Out of the results that came into public health yesterday, did that how many of those consisted of staff members and how many consisted of inmates?
So those were only inmates. We anticipate receiving the results for the employees, but we have not received all of the information yet on employees. So those were only the inmates.
Okay, and is there any, I guess, indication of where this, when this started, or I know the testing was done last week, but did an individual bring it in on the staff, or is there any indication of how this started at the NEAL unit?
That would certainly be something to ask the NEAL unit. They made that decision internally.
Okay, absolutely. And I guess my next question is for Dr. Weis. You talked a little bit about this new testing. I believe you call it like a respiratory testing thing with testing for COVID and testing for other things as well. Can you talk a little bit more about that and when you started to implement that and why it's important to test for all those things at once?
Well, so David, great question. So these respiratory panels are not new. So a number of the different testing companies have offered this, and they'll test for anywhere from 12 to 16 different common respiratory viruses. So we've been using these for many years. Thankfully, this year, the one we're using, BioFire, has now added COVID-19 to that panel. So BioFire is a good example. They already had 4 different COVID or coronavirus tests on there. Now they've added number 5, which is COVID-19. So when we do this, what allows our doctors in the ED or stuff is to do a test, and they can tell the patient, you have flu, you have rhinovirus, you have enterovirus, you have another coronavirus. So it's actually helpful in terms of not only does it rule out COVID-19, it tells us exactly what might be picking on that patient. So we've started using this now. Now we're heading into respiratory infection season. To be able to tell people exactly this is the virus you have and not COVID-19.
Absolutely. And is that something that, Dr. Lementier, is that something that BSA is using as well to, I guess, determine what respiratory illness an individual may have?
Yes, we have had a respiratory viral panel for some time in terms of the various viruses that cause very similar symptoms. The fact is that historical panel in terms of utility has not been overly helpful in the sense that we know that most of those infections are self-limiting. So whether you have rhinovirus, whether you have a different coronavirus, didn't really matter in the past very much because we kind of knew the clinical course that you would take. Now things are a little bit different, meaning obviously with COVID-19 and the other differential diagnoses that we have to consider in terms of your presentation, I agree that it is helpful to understand that, number one, you don't have COVID-19. And then beyond that, whether or not you're dealing with a viral infection or something else, potentially a bacterial infection, obviously would be our next biggest concern, and some other viruses that may cause more significant illness. We have the ability to utilize a cartridge that will test you for COVID-19, influenza A and B, and the respiratory syncytial virus. It's one that our Cepheid vendor is going to be sending to us in about the next week or two. We got some more information yesterday that was sent forward to our lab director and myself that this will be available to us soon. So I think that will help us in terms of, again, some of that initial triaging and understanding of what our patients may or may not have. We also are going to have antigen testing available to us over the next couple of weeks, which I think myself and Dr. Weis have both mentioned is another way for us to diagnose COVID-19 with a different route in terms of the testing modality, I should say. And that will be something that will help to diminish the amount of PCR tests that we need to burn through as we get into the winter months. And positive tests on the antigen platform are certainly very helpful and reliable.
Absolutely. That's all the questions I have. Thank you, guys. Have a great rest of your week.
Right.
you,
And
David.
I'd like to say one thing that helped, and I agree with Dr. Lehman too, most of these viruses in the past, you treat the symptoms and they went away. One thing that's helped now, I think, is not only could I tell them you're negative for COVID-19, so I can essentially rule out a false negative by saying you do have this virus. So that's why I think these panels may be a little more useful in this season, just because now we can say it was not a false negative for COVID-19. You've got coronavirus, another one, and we can tell them exactly what they do have then.
Thank you for the clarification. I appreciate it.
Agree.
Thank you, David. We'll now go to Kevin Welch of News Channel 10. Kevin, how are you today? We'll now go to Kevin Welch of News Channel 10. Kevin, how are you?
I'm good, thanks. Say, I guess the first question would be for Casie. Is all contact tracing that you do done locally, or do you have to sometimes use the Texas call center when the caseload demands?
So right now we're doing all of our contact tracing locally.
Have you been able to handle the demand in the past too, locally?
Yes, right now we are.
What impact will the Neal unit numbers have on the statistics for Potter County and Amarillo as far as things like positivity rates? Are they going to be separate, or are they going to get folded in?
They will get included in the total numbers, and so with the positivity rate, they will certainly lower the positivity rate because the denominator will increase, but over time that will certainly trend out.
And can you clarify how many cases were not Neal numbers yesterday?
Yes, we had 110 that were not Neal associated with the Neal unit yesterday.
Okay. And Dr. Milton, do you expect to have any numbers coming in from the Clemens unit, or are you going to have a mass testing out there? Do you know?
I don't know, and I wouldn't expect that, no.
Okay. Okay. And you may not believe it, but we're getting phone calls about haunted houses and trick-or-treating. So does the city have any guidance on that?
Yeah, the haunted houses do not fall into the category of businesses that are allowed to be open at 75%. Also, the governor's executive order GA 30 references that all of that order is in accordance with a number of entities, including CDC. CDC does have specific guidance regarding trick-or-treating and haunted houses, classifies those two specific activities as higher risk activities, and is very specific, saying to avoid these activities to help prevent the spread of the virus that causes COVID-19. So our recommendation would be to not do those this year, to find other alternate lower risk ways of celebrating and conducting Halloween activities. And they do give recommendations on that on the CDC's website.
Okay, that's everything. Thank you all.
Thank you, Kevin. Let's now go to Morgan Durden of KBI Channel 7. Morgan, how are you today?
Hello, good morning, everyone. My first question is for Casie. As of this morning, the Texas Department of Criminal Justice reported of the about 1,000 or so cases, like everyone's been talking about, at the Neal unit. 40 of them, they're saying, are employees. So is the city concerned for those people who went home to their families, went out in the public, and for people who continue to work in that hotspot?
Absolutely. So we consider anybody who has COVID-19, that is certainly someone who is of high consideration. We will continue to work with the Neal unit as they send us information. They will do their own internal investigation, and then we will work with those individuals to make sure that we have done their contact investigation so that we can appropriately work with their contacts and their families, so that we can help keep them safe, help keep our community safe, because that's the #1 goal.
So the city has not already done that. We're waiting for them to report to you guys for the contact tracing?
Yes, so we have to wait until they send us the information because we don't know who's positive right now.
Okay, thank you. And then Dr. Weis, next question is for you. You kind of mentioned about the university health services dealing with this large cyber attack. In the midst of COVID, how are you handling patients and procedures? You said yourself it's kind of hard to read physicians' writing. What are you doing to make sure that your patients are getting the best care and it's not affecting them?
Absolutely. No, good question. And again, we have these well-rehearsed downtimes. And the truth is, I was kind of joking about the physician writing. For the most part, our nursing staff, physicians are all on paper at this point. But we have practiced these routines, knowing that it's not if, it's always when you're going to lose your computers at some point for whatever reason. So I think most hospitals have the processes in place where we convert right back to what we did before we had EMRs and computers. And so overall, we have seen no disruption of the service in the hospital. Patient safety is absolutely critical, and that's the thing. So overall, we've been very pleased. That the fact is that for the most part, things have worked well. Our units are operating the way they're supposed to on downtime. It'll be a matter of when we get the computers back up, is probably retrofitting some of that data that we have and just putting those patients' records in the charts when we have the electronic medical record back up.
And do you have a special group that's working to, kind of oversee this happening, or is it just nurses and doctors on their own right now?
So no, it's well, you say special groups. So I mean, we've got everything from corporate support. We have multiple calls a day where corporate's updating on their progress on their front. Certainly we have our IT department that's been working around the clock. But because we've also had a number of units or departments such as accounting who really can't do anything without computers, we're utilizing those folks on our clinical units to help with running any paper down to lab or stuff like that. So we're actually reinforcing our units with people who can't work right now because of the computers, and allowing them to be kind of helping hands and make sure that we've got everything working well.
All right, that was all my questions. Thank you.
Thank you, Morgan. We'll now go to Aaron Langston of KAMR Channel 4. Aaron, how are you today?
Doing good. How are y'all?
Good.
First question is, before the Neal unit numbers came out Monday, we were seeing a sharp increase in cases last week and beginning of this week. Does that create a concern for community spread and going forward?
So yes, so anytime exposure doesn't happen in a linear fashion. So anytime we have, one person who's positive, they may expose 2 or 3 people, and then those 2 or 3 people, if they become positive, can expose another 2 or 3 people. So it happens in a more exponential form than a linear form. And so as we have additional cases, then we have the potential to see even more cases. And so that's why we talk about those prevention efforts. We talk about masking is so critical. Hand washing, staying 6 feet from others, all of the prevention efforts that we have talked about for so long remain incredibly important now. We know that our community is tired, we're all tired, but staying vigilant is key to our success right now, and we all have the power to do that, to make our community successful. And so we just want to encourage our community, even in that tiredness, to just be ready, and to wear our masks, and to just be ready to protect one another.
All righty, thank you. And have we seen any cases where we had somebody who had tested positive and recovered and then later tested positive again?
Yes, so we are starting to see a few cases of reinfection. And so again, those prevention efforts are so important, because it is possible to be reinfected with this virus after a certain number of months.
Okay. And how many school-related exposures and positives are we seeing right now?
So, every day we work cases, and we work the information that were sent by local providers and the local schools. Those numbers, the specific numbers, are on the dashboard, and so I can certainly get the specifics to you after this call, but those are all, those are all on the dashboard.
All righty, I think that has been covered. Thank you very much.
Thank you, Aaron. Those are all the questions we have from the media at this time. This concludes our weekly news conference for the latest in COVID-19 information for the community. I want to thank all of our panel members who took the time out to participate today and have been doing this for, I think, going on almost 7 months now. Thank you. This is David Henry. I'm the communications manager for the City of Amarillo. We will see everybody next week. Thank you.
You did.
You.